anybody here that this could be switched out for a single-payer system.
No.
I mean, completely just done. Right now, this legislation, Section 1161, cuts more than $150 billion from Medicare Advantage. So those who are taking care of Medicare Advantage, this isn't what you'll be able to continue to do. So people saying that this is just going to transform us into Medicare as it is, in fact, the bill itself cuts about $500 billion from Medicare over 10 years. When we've had exploding costs going on, where is that going to come from? I point that out just to say that the numbers that people are relying on.
Not that bill.
Hey, we're not voting on that bill.
Do you support Medicare as it stands now for every U.S. citizen?
No. No. I don't.
Then, will you abolish Medicare as it stands now for every U.S. citizen? Then you're a hypocrite.
Thank you.
Optometrist, been practicing for 15 years. First 4 years I served as an optometrist in the U.S. Army.
All right. I'm really against mandated altruism. There's nowhere in the Constitution where it says that we are mandated as a government to take care of the indigent and the victims, the children, whatever the case may be. That's why if I see somebody who doesn't have insurance, I can give them a free eye exam. It's individuals, it's good Americans like these people are doing. It's about churches. That's right. That's how we take care of our people.
Right.
I'm sure you concur with that. Now, on a different note, H.R. 3226, the CZAR Accountability and Reform Act. I want to know what your feeling is on that. Because I don't like these guys that have no accountability, making a shadow government who's going to turn out to be the next oligarchy.
That's right.
Thank you. For those who don't know, there are a lot of so-called, they aren't called in actuality, but they're referred to in government as CZARS. People who, basically we have an auto industry czar now, we have a healthcare industry czar, we have CZARS, the people that don't have to go through the committee, or I'm sorry, the Senate process to actually be okay, and you get around that. Now, many presidents have had CZARS in the past, I think far too many, but this is at a level that has never been before. At last count, there were 30-some CZARS running around out there, reforming your auto industry and whatever else. It needs to stop, you're right. So I will support that legislation. Thank you.
Thank you for being here tonight. My name is Maggie Reeve, and I read something in a book earlier today that I'd like to repeat. We voted the politicians in. I'm paraphrasing, by the way. And they voted for the poor. It's time for us, the United States citizens, to stop sitting idly by and start doing something. So thank you all for being here tonight. I lost my job in November because a lot of people aren't remodeling and a lot of people aren't building homes right now. They don't need my services as a kitchen designer. And thus and such, I have no medical insurance right now. So 2 months after I have no medical insurance, I end up in the hospital 4 days, and I get a hospital bill for $18,000. Well, they instantly took $5,000 off of it, so that left me at $13,500 and some change. I had a family member that helped a little bit. I have some savings that helped a little bit. And there was a Catholic organization in the hospital that helped a little bit. So thus and such, I'm not going to end up with a big bill that's going to eat away at me the rest of my life. But the people that helped me helped because it was their choice.
Right.
Not because the government told them to take action. When I'm back on my feet financially, then I can help these organizations so they can help the next group of people that
That's
need
the way it
help.
goes.
We don't need to be told how to help others. That comes within our heart, not within our government. I know we're not answering all the questions here tonight, but I have a thought or question, and I'd like to know if there's been any discussion in Congress that you would consider 3 or more bills instead of putting it all into one huge, gigantic bill that no one
Not a bad
understands.
idea. Break it
Break
down.
into costs and services and some of the different things that we've discussed this evening. And then that could be one bill. Another bill could be the uninsured citizens of the country. And then another one could be stopping the fraud. I believe there's close to $6 billion a year or more of fraud going on that the U.S. government alone pays, not necessarily the insurance companies, but just the government has to deal with. Why don't we make it a little bit easier for us and for you, and that way, less poor? Thank you for listening.
Thank you. You make a very good point. I mentioned some of the reforms that we can do. One great one that John Shattuck from Arizona has championed for a long time is allowing individuals to purchase health insurance across state lines.
Yeah.
Can't do so now. You can purchase auto insurance or other kind of insurance across the lines, but you can't health insurance. That would help bring down costs tremendously because it promotes competition. We could do that with one single bill. Another one would be liability, tort reform. We could do that individually. We don't need a full, broader bill. We can see how these things bring down costs, improve quality, without doing a massive piece of legislation that has unintended or intended consequences that we really don't want. So, thank you. That's a very good point.